So we know that geriatric assessment improves communication really for any patient with advanced cancer who is undergoing treatment in the oncology clinics. The geriatric assessment guideline, however, recommends geriatric assessment specifically for patients starting chemotherapy, recognizing that geriatric assessment can also not only help with communication but may help with decision making. And so I would say if you're going to do this, you should do it for patients over the age of 65 starting chemotherapy. Start there. Oncologists do not have to use the geriatric assessment I used in my study, which really is a research geriatric assessment because I'm collecting lots of data, but really go to the guidelines where we worked with community oncologists to identify the highest priority tools that were the easiest to implement. And so that geriatric assessment should only take on the order of 10 or 15 minutes. A few minutes, about 5 minutes of staff time. Patients can complete the surveys in the office, and anybody can help organize the geriatric assessment. It does not have to be the oncologist. In my clinic, I have staff who mail the assessments out ahead of time. The patients bring them in. Can also be done in the waiting room. I have staff then, as they're doing the vital signs, do the mini-cog cognitive test and do a physical performance test. Takes them a few minutes. They bring the information to me. I'm ready to see the new patient. I open up the computer, I look at the cancer information and history, and I have that information right in front of me. Then I go in and talk about it and make decisions. So it's not more work for me, it actually helps because I have more and better information, and I'm not trying to figure that stuff out when I'm in the room. I have it ahead of time. And as oncologists get used to it and recognize that it can help them and help patients and caregivers, I think that they'll adopt this model of care more in higher prevalence.